Gordon Chang is a foreign affairs journalist and expert on China. Susan Lee, Fox Business Network, has lived and worked in Hong Kong. And good afternoon to both of you. Gordon, let's begin. You don't think the criticism yesterday went far enough. Why not?
Yeah, the World Health Organization helped spread this disease around China. On January 14th, it sent out a tweet saying that based on the information it got from China, they saw no evidence of human-to-human transmissions of COVID-19. Well, the World Health Organization should have known that there were, in fact, such human-to-human transmissions. The Chinese government probably knew second week of December, certainly third week of December. So what Beijing has doing is it has been taking Beijing's line. And the other thing that WHO did was it encouraged countries not to impose travel bans on China. Remember, this disease spread outside of China's borders because of travelers from China. So those two things meant that this disease is much worse than it would otherwise have been.
You referred to two of them. First, here's a statement from the World Health Organization on January 10th. The World Health Organization advises against the application of any travel or trade restrictions on China based on the information currently available on this event. Here's the tweet 4 days later. Preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus. Is it possible, Gordon, they just did not know at that point? Could that be an explanation early on?
If we're talking about, let's say, the third week in December, yes, the WHO would have a reason not to know. But we're talking 3 weeks later than that. And I think that WHO, working with China, knew exactly what was going on because what was occurring inside that country could not be explained other than human-to-human transmissions. Now, Beijing was very secretive. It tried to deceive the world. It enlisted the WHO in that effort. And because of that, countries did not take precautions that they ordinarily would have adopted. And we heard that from the White House coronavirus task force last week from Dr. Birx.
Yeah. The Chinese Foreign Ministry says it's all untrue earlier today. Gordon, the track record's not solid. 6 years ago in Ebola, the World Health Organization screwed that up. And they were roundly criticized from all over the world for reacting too slow in Western Africa.
Yes, and we've seen the same thing this time. The WHO has a really bad track record. Our CDC has a much better one. And unfortunately, the top level of the WHO has been propagating Beijing's line. So, for instance, you heard the number 2 at the organization said they had absolutely no reason to believe that China's numbers weren't 100% accurate, when we can see that that was clearly not the case.
But even and so, also, this time, Gordon, the CDC screwed up that initial test in February. That was a big problem. Also, go ahead, finish the line.
Yeah, I think the CDC did not think this was a big of an event, and they did that because of China's low statistics. Dr. Birx mentioned this. She said this looked like SARS of 2002, 2003. It didn't look like a global pandemic, which it turned out to be. And that was because of China deceiving everybody.
Let me bring in Susan Lee on this. Susan, what is the state of China's economy now? Wuhan was, I mean, they lifted the gate in the last 24 hours or so.
After 76 days,
right?
Yes.
They're well into their fourth month now. What is the status there?
Well, the status is after 76 days, people are finally allowed to leave this industrial town of 11 million. But you have to basically present your accreditations and credentials to leave the city. So they have this government-sponsored app that tracks your addresses, your medical history, and whether or not you're contagion risk. But if you speak to people in Wuhan, things are not back to normal. We know that 94% of businesses have reopened. People are still not going out to restaurants. People are not going to the movie theaters because they've been traumatized by the death and also the lockdown that they've experienced over the past 2 months.
Yeah. Susan, I know you cover the financial aspect of this country quite closely. There's an alert crossing right now. The IRS says that those checks will be in the hands of millions of Americans starting next week. That would be lightning speed for trying to get this program off the ground.
Yeah, that would be lightning speed. So we're talking about the $1,200 checks and $500 for every child under 16. Also, the SBA loans, some are very concerned that this $350 billion, now increasing by $250 billion, is being slowly doled out to these small businesses that want to keep their headcount, keep the jobs, because they employ close to 80% of Americans. So the U.S. economy is still expected to take a big hit. Whether or not that's prolonged, I think it depends depends on how quickly you get money and cash into the hands of business owners and Americans.
One other thing on that, the Small Business Administration, they've got their work cut out from that. They're trying to take massive amounts of money and flush it out across the country. It hasn't been easy thus far.
No, it hasn't.
Are they doing better?
You know, the community banks are doing the heavy lifting right now. The large banks, we're talking about the Wells Fargos and the Bank of America and the cities. Anecdotal stories say that they have been rejecting customers. If you don't have a long history, a long credit history, a large credit history with these banks, they've been turning people away. So whether or not they will be the heavy lifters, and they probably need to be since they oversee the majority of the trillions of dollars in bank assets across this country, I think reparation in this economy depends on these big five names.
So much of our economy is tied with the Chinese economy, as we well know. Gordon, on that point, you believe a substantial penalty must be paid and placed on Beijing on behalf of the international community. How do you see that?
Well, I see that because we got to deter China from doing this again. Its behavior in the coronavirus epidemic was so much worse than the behavior during the 2002-2003 SARS epidemic. Beijing knew that this was human-to-human transferable. They not only kept it secret, which would have been bad enough, they actually deliberately tried to deceive the rest of the world. And as I mentioned, that meant that other countries didn't take those precautions. So they has to, I don't know what was in the minds of the Chinese leader, Xi Jinping, but if he wanted to cripple other societies, he would have done exactly what he, in fact, did. And we can't forget that because of what's happened to not only the United States, but other countries. So we need to make sure that this never happens again. And the only way to do that is to impose great costs on China.
Gordon Chang, thank you. Susan Lee, thanks as well. The economic, the political front, the health front, thanks to both of you. Meanwhile, here